New radio in the Door County Daily News, and 5 years ago, we were all glued to what you would say in front of this background in this room.
In this very room.
As we talked about COVID. Last week, Green Bay media celebrated the first case kind of in northeast Wisconsin. We're still a week away from when Door County had their first case, and today, we once again just kind of uncovering old memories, stay-at-home order 5 years ago today.
Yeah, wow.
And I guess, first of all, when you hear that and when you see some of these tributes and stuff like that 5 years ago, does it seem like it was 5 minutes ago? Does it feel all that 5 years, 500 years? What does it feel like to you as somebody that did this for so long?
It's hard to believe it's been 5 years. I know a lot of it. One of the things that I find so interesting is that so many things about, like when at the time we were telling people how long they should, their incubation period and quarantine and things, I couldn't tell you what those were anymore.
Yes.
I have no memory of those facts. It's like I put them out of my head. So it's been a lot. It's been quick, but it's also obviously it feels like quite a while ago.
And when you reflect on those Facebook Lives, and I had a chance, I looked at a couple of them as well, where you're just getting peppered with questions on something where we were all learning about COVID kind of in real time.
Right.
And just getting those questions, not just on Facebook, where you probably have Aaron who's sitting over there, or Brian kind of feeding you some of these questions.
Yeah.
And you kind of have to go, I don't know.
Yeah. Well, I mean, the whole thing was, I kind of knew it was a scary experience for most of us because we had no idea what we were facing, what we were going to face. And so a lot of it was just trying to be as genuine and honest as we could. I mean, because, we kind of, in many ways, we heard things from the CDC, we heard things from other public health organizations, and we kind of parroted those because I don't think anybody had any idea. We kind of early on decided, at least for Door County Medical Center, that our true north in those days was going to be CDC. That whatever they had said, we were going to go with that because we had no way of knowing any better. And I know I was on calls. I think it was it once a week or was it twice a week? Calls with all the hospitals in northeastern Wisconsin, and we talked, and we all were in the same boat. None of us we didn't really know what was going on, what to expect. And we just wanted to try and make sure that the hospitals didn't get overrun with sick people that we couldn't handle.
And, we mentioned this is the 5th anniversary of the stay-at-home order. Weeks later, that's where a lot of masking became really big and stuff like that. And people first, basically, we were talking about with my parents, where my mom had to work from home and her job was to make masks. For people.
Right.
And that was before PPE was able to kind of catch up, so people could have real masks and things like that. When you kind of look back at that type of stuff, what's kind of the things that go through your mind? Because, at that point, I felt like we were kind of going through Hail Marys and just think of anything that could potentially help.
That's absolutely right. I mean, I think that we were lucky here, and I think even in Green Bay, where we didn't have the shortage. Our supply guys were outstanding because they saw this coming, and they ordered masks and things like that. So we never had a situation where we had to use the same mask for a month at a time or anything like that. So that was good. But then it was with the public. Initially we thought it was droplet, which meant that if you spit a drop, it'll fall after so many feet in front of you. So if that's the case, then cloth masks would work fine. So we had people, my wife included, she made a ton of masks for that reason. And then later we found out it wasn't that. And so we literally were just trying to make do with what we could at the time. And I still think it was helpful. I mean, there's all kinds of arguments about are masks effective or they're not. I mean, I think the one thing that we learned is that one year in COVID, there was no flu season. We had no influenza. That entire year didn't exist. You look at the graphs now, and it was flat. So obviously they did something.
And, moving forward and stuff like that, we were kind of talking about before, and you can probably see on those videos online just how divided things got. How hard was it for you to kind of be in your position, but talking to friends, talking to families about this, that could be either on one side where it's, this isn't a thing at all. And then there was other side that were just absolutely terrified about what this could bring.
Right. I mean, the hardest part was sort of not, I didn't understand the division. I didn't get it. I mean, because we were in the middle of just trying to sort out how do we keep our community safe and how do we keep there from being deaths, because we were starting to see deaths that were mounting and mounting. And so when all of a sudden it became kind of politicized and people were arguing that, making me wear a mask is taking away my freedom and things like that, it was a complete mystery to me, because that wasn't at all what, I don't think anybody was really thinking about that, at least that were in the trenches, so to speak. So that was a surprise. And it really, I will say that of any trauma that came from COVID, that was one of them. It was sort of like, how did we get to this point where all of a sudden we're taking something which we're just trying to prevent people from getting sick? Because I was actually working in the hospital at the time, taking care of patients that during the entirety of COVID, and people did not die well. And so I was seeing this and then hearing people arguing from a political perspective, and that was just hard to take.
And now when we look forward, obviously we've had vaccines now since 2021. We've gone through a few different cycles of it. We've gone through a few different iterations of the virus itself. What are some of the things that maybe you're seeing now that could, maybe when you look back at 5 years ago, you go, man, it's hard to believe that we're here now?
Yeah, that's a good question. I think that the hardest part was getting to the point where there was some degree of herd immunity, and that came from the vaccines and from people getting sick. And without the vaccines, the only way you get herd immunity is to burn through a population. So rather than having whatever it was, 1 million or 2, it would have been 5 or 6 or 7 million, to get there. So the fact that we were able to get a vaccine, and I say we, I'm not part of that, but that science was able to get a vaccine developed into market in a year is astonishing. And so that was a good thing.
And now people, when they get COVID, it's almost like the flu. It's almost like some of the other respiratory diseases where it's just like, okay, just stay at home and do that. How important is that for people just to kind of maybe get past that initial hump where there was a lot of fear and now it's just kind of among us now?
Well, yeah, and I think that's the whole idea with a novel virus. We kept using the word novel, and I think people didn't quite, I know I didn't either, take that as to what does that really mean? And it means no human has seen this. And so no human body has the ability to fight this off because it hasn't seen it before. So the disease is going to do what it's going to do. And so it's either going to affect you minimally if you're otherwise healthy, or it could kill you if you're not. And that's what we saw happen. And so now, because we have herd immunity and we've seen it, there's vaccines, people have been sick, it's like the common cold, and it's really not a big deal.
Now, we're here, and we kind of mentioned before, you recorded, it was, I think my count, 26 videos between late February, early March to the end of 2020. Okay. A little bit more sparingly as vaccines and stuff like that.
Right.
What was maybe the positives that you were able to go from almost a communications point of view to be able to communicate this type of information to people that were tuning in?
Well, I really enjoyed being able to do it because I thought that was one way, and the number of viewers kind of showed it. We had a lot of viewership, and it was great to be able to communicate, at least to our community, what we knew and what we understood, which may or may not have been a lot, but I think it was just good to try and get information out there, because I think that's probably the worst part in any situation that's stressful is lack of information, is not knowing. So it was kind of a privilege to be able to do that.
Are you ever tempted to look back at those videos and
no.
Like, oh man, I can't believe I said that?
Yeah, no, not at all. Just because, you literally you do the best you can at the time. And obviously, as knowledge is gained over the course of time, I always had this conversation. Some friends of mine early on asked the question, should we have closed businesses down? And I said, well, and this was after we'd been in it for a while. And I said, well, maybe not. And my wife gets so mad when I say that, because she says, how can you just, after all that you went through? And I said, no. I said, but obviously hindsight's 2020. I can look back and I can say that maybe that wasn't the smartest thing, but we didn't know any better. And all we wanted to do is make sure that if someone came in with a heart attack in the midst of COVID, we could treat the heart attack. Yep. Because the hospitals were so full, we didn't have the ability to do it. So that was the reason we made those decisions. But were they right or wrong? That's for historians to decide.
You know, to say it's easy. It's easy to say this is the right thing to do 10 minutes ago, but now 5 years ago, now 10 years ago. I mean, 5 years into the future now.
Yeah,
it's a little bit harder to make that same call.
Exactly.
Well, Dr. Jim Heise, the Chief Medical Officer of Door County Medical Center, we had to do this for the 5-year anniversary.
That. Yeah.
Maybe not necessarily something that we want to celebrate, but something that's important to recognize. So thank you for doing this with me today.
My pleasure.
I'm Sue Powers. No, just kidding. I'm Tim Coles, Dr. Jim Heise from Door County Medical Center. You've been watching New Radio and the Door County Daily News.